Can low back pain be caused from any other structures in your back besides your lumbar spine? The answer is yes. In many cases, possibly in the highest number of cases, the answer is the sacroiliac joint. I'm Dr. Scott Glickman. I am a neurosurgeon here at Total Spine and Orthopedics, and I'm here to talk to you today about sacroiliac joint pain. We have two sacroiliac joints, one on the left and one on the right. You can have pain that develops from one or both at the same time. In many cases, this condition happens spontaneously, or it can happen from trauma, or it can happen from even prolonged rest or position. Sometimes the pain that comes from the sacroiliac joints is disabling, and sometimes it is simply a nuisance. In many cases, treatment for this pain can be very simple, such as taking anti-inflammatories or some simple pain medications. Sometimes it is much more involved and may require injections and possibly surgery. Most of the reason that people require further interventions is because the problem has become chronic, or it's been a severe indication or a severe problem that led to the pain and dysfunction in these joints. Pain in the sacroiliac joints is often confused with other sources of low back pain. That can be from the lumbar spine, the hips, other parts of the pelvis, and in fact, the whole muscular girdle around the pelvis. Pain that is lateralized, meaning it goes to the left or right side, can be caused by the sacroiliac joint, just as it can be caused by the lumbar spine, such as a disc herniation or other condition. Many people are told that they need to have lumbar spinal surgery, such as discectomy, laminectomy, or fusion, when in fact their pain is coming from one of or both of the sacroiliac joints. And often the treatment for their sacroiliac joint pain is much easier, much more successful, and much more minimal than the proposed or actual surgeries that people undergo on the lumbar spine. That does not mean that they don't have lumbar problems at all. And sometimes sacroiliac pain and sacroiliac joint dysfunction occur at the same time or in the same patients as people who have additional lumbar back problems. Evaluation of the sacroiliac joint is not as simple as reviewing imaging. People who have sacroiliac pain often will have normal x-rays, CAT scans, and MRIs, but yet they have severe pain. Sometimes they will have minimal disc bulges in the lumbar spine and are told that they have disc herniations or other problems, and often go through many different treatments such as injections and sometimes even surgery when their pain is in fact coming from the sacroiliac joint. The physical examination of the sacroiliac joints begins with palpation of the area and inspection to make sure that there is no other injury that's visible. It includes a postural examination, and then it includes a number of leg positioning movements and strength tests that may or may not elicit pain in the sacroiliac joint or joints. If you have positive tests on physical examination, then you may be properly diagnosed with sacroiliac joint pain or sacroiliitis or sacroiliac joint dysfunction. These are different diagnoses that all revolve around the sacroiliac joint. In further evaluation of these, with proper timing of both medications to see if there is improvement in their condition, which may lead to diagnostic and or therapeutic injections into the sacroiliac joints and into the area around the joint that has the nerves, as well as many ligaments that hold the joints together, we can determine if the pain is coming from the sacroiliac joint region specifically, or if it is not. If the pain is coming specifically from the joint itself, then a diagnostic injection with a nerve block of the nerves that innervate the joint will lead to a complete resolution of the back pain. If that occurs, then you can clearly say that the pain generator is in the sacroiliac joint and the nerves that innervate that joint. If you do not have complete resolution of your pain, then that is not where the pain generator is, and you may need to look elsewhere. Once you've had injections that are diagnostic and possibly therapeutic for your sacroiliac joints, people often will ask, well, how come my pain came back? Sometimes, and in many cases, especially chronic and post-severe injury to the sacroiliac joints, the pain relief is only temporary. And that can be a matter of days, if not weeks, and sometimes months, but then the pain will return. If the pain returns, but the pain was gone from the injections, then treatment can be clearly determined. Treatment options for the sacroiliac joint dysfunction are several. The initial treatment is with anti-inflammatories, possibly muscle relaxers. That can relax the area, that can allow the body to heal itself. In some cases, 1, 2, or 3 months, or possibly even more, will be desired by the patient and may, in fact, lead to a complete healing and resolution of the symptoms. In many cases, people cannot tolerate pain or do not wish to or cannot take anti-inflammatory medications for a long or prolonged period of time, and they will choose to undergo 1 or 2 or possibly 3 or more rounds of injections into the sacroiliac joint area. If those injections continue to be therapeutic for them, that is an ongoing option. The next option is a surgical option, and surgery for the sacroiliac joints comes in 2 forms. The first option is a sacroiliac joint fusion. There are many different approaches to performing a sacroiliac joint fusion. Some are intra-articular, meaning they go through or lock the joint together through the joint. Some are from the outside, where they lock the joint together from the outside in, and some go from the inside out or obliquely. Whether or not you need a fusion of your joint, this can be accomplished many different ways based on you. Another option that is only for relieving pain is something called a rhizotomy. Rhizotomy procedure is a nerve avulsion of the small nerves that innervate this joint. And if there is no joint dysfunction, which often occurs in young people that only have pain but no severe injury to the joint, and they have not had this for an ongoing period of time, then a very simple procedure that is an endoscopic procedure, which is very minimally invasive, can be performed to identify the nerve and actually cut the ends of the nerves off, which is a safe procedure. And that procedure will then lead to the nerve endings growing back in a healthy fashion, and those nerves are no longer going to be angry. That is only a consideration for people that fall into a certain category, whereas fusion can be performed on everyone else. Sacroiliac joint pain is a complicated problem that is very common. It's only complicated because it's so often misdiagnosed as lumbar problems, or misdiagnosed altogether, or not diagnosed altogether. Proper treatment should begin with conservative measures such as anti-inflammatory medication and move on to more interventional diagnostic maneuvers after it has been properly diagnosed from a physical examination. Surgical options should be considered only when non-operative treatments have failed. I'm Dr. Scott Glickman. If this sounds like what you're dealing with, please come and see me.